Good morning. It's Thursday, May 6th. Welcome to The Doc is In, Ask Dr. Arwady. I'm Sybil Madison, your Deputy Mayor for Education and Human Services, and I'm here with Dr. Allison Arwady.
Good morning.
Your Commissioner for the Chicago Department of Public Health. We are so happy to be with you and to answer all your questions and give you the latest on COVID-19 and vaccine here in Chicago. You can submit questions in the chat box below. You can also send them to us using the hashtag AskDrArwady through Facebook or Twitter. We are going to check our distance.
Looks good.
Looks good. We're both fully vaccinated, but we still are keeping that distance and being mindful of all the precautions that we still need to have in place. You want to take us through some data, Doc?
I do. So chicago.gov/coronavirus. That has been your place for almost a year and a half to come and get the most up-to-date data related to COVID. You can get to data off there. You can get to our vaccine information. You can get to statistics that go all the way back to the beginning of the outbreak if you're interested. The dashboard that gets updated every day is chi.gov/COVID-. We actually are planning probably next week to incorporate some of the vaccine data that right now you have to go to the vaccine page a little more into that same dashboard, and working on some really nice tools where you'll be able to look at your zip code and have a lot more of that detail related to vaccine. So our epidemiologists and some of our partners at Slalom and others have been working on that. So
it takes a lot of work to do that.
It does take a lot of work, and there's a lot. If you haven't looked at the vaccine dashboards that we have now, there's a lot of really good information on there. It gets updated every day, but we know a lot of people have gotten used to going to this dashboard and wanted to pull that in together. So hopefully next week we'll be seeing that going live, so everything will be in one place. But in the meantime, let's look at the dashboard in terms of how we're doing with cases, which generally continues to be good news here. You see we're at a 4.5% positivity. A week ago, we were at 4.6, and 4.5 is actually the lowest that we've been in a number of weeks since before that most recent smaller surge. So
and
nice to see progress.
Is where we want to be.
Under 5 is where we want to be. So that is good. With some of the reopening, this is the hope. We continue to see things head the right direction, even if we see that a little bit more slowly. Yeah. Our testing remains very good. We passed a milestone yesterday. More than 4 million COVID tests have been done in Chicago residents alone since the beginning of the outbreak. That is a lot of COVID tests. We've only got about 2.7 million residents. So, that's just recognizing that a lot of people, most people in Chicago have been tested for COVID at least once, and then a lot of people who've had multiple exposures or getting tested through work, et cetera. So let me just give a quick shout out to the thousands of people across this city who have been part of COVID testing through clinical settings, through our drive-through and walk-up community-based testing sites, through laboratories. It's important that people continue to get tested. We know that there is still COVID around, and so if people are having symptoms, remember, you got to stay home with symptoms, you got to get tested. And even as testing continues to expand, you can now order an over-the-counter COVID test. They're available on Walgreens and Walmart, CVS. You can order them online. They're, I think, $23.99, and you order them and you get 2 tests. It's a self-swab in your nose. It's not the deep kind, and you can put it in. There's directions that come with it, and you get it's kind of like a pregnancy test. You get a result on the spot at that time. And you get 2 swabs in one package. You're supposed to do it twice, 36 hours apart from each other. But regardless, this includes people who have been tested in clinical and public health settings. So our testing looks good, almost 13,000. And down just 4% from a week ago. And then you see our cases are averaging now 505 per day, down from 528 a week ago, also down 4%. So you see that's been relatively flat. We want that number. What?
Well, actually, we want it to be below 400.
Very good.
But ideally below 200.
That's right, exactly. Yep. And so that's what, and again, if you want to look here on the reopening pages and on the data, you can see exactly how we're doing with hospital capacity and all of the things that we follow for reopening. But that case count is still higher than we'd like it to be. But it's the only one that's still in high risk. Nothing's, none of the main indicators are in that very high risk. Most are in the moderate risk, and then the positivities in the lower risk. So things things are at this point looking good, where we're thinking
Kind of
about
coming down from that little
we're coming
bit of a
down from
surge we
that,
had.
and looking toward next week, hopefully being able to make that next turn of the dial related to reopening. So thanks to everybody who keeps getting vaccinated, first and foremost, and then people who are continuing to be careful so that we see this decline continue. All right. I think those were my main data updates. I wanted to just, before we get into questions, just share, there's been a lot of vaccine news in the last few days. Obviously a lot of reopening announcements, and if people have questions about that, we can take them. But in the actual world of vaccines, so not only are we anticipating probably early next week, the FDA and its advisory committee will probably grant an extension of the authorization to adolescents, 12 to 15 years old, which is really exciting. Pfizer also shared that potentially as soon as September, they expect that they may have enough data back to be able to offer COVID vaccine for children ages 2 to 11.
Oh, wow.
So yeah, that's not a for sure in terms of that timing. Those trials are still very much ongoing, but those early signals tell us that the safety data is looking good, the efficacy data is looking good. They've been looking at dosing. So it is not approved yet for anybody under the age of 16, but having seen some of that preliminary data for the adolescents, it looks really good. And I think that early signal, I'd sort of been expecting that it might be the fall where we might see some availability for the younger kids, and at least what we see now, it's looking like it may be in that kind of time frame. So that was some nice news. The other thing that Pfizer shared was that they expect probably this month to be able to have enough data to submit for the full authorization, the full approval of their vaccine. The vaccines that are in use right now are all under what's called emergency use authorization, which is a way of authorizing vaccines that does not skip any steps in the process. It does all of the length of the testing, and it has all of the advisory pieces. You do the double-blind study, you follow people for the full amount of time. But it's a way in a public health emergency of basically a process will sometimes take multiple years to get a drug fully approved. For a public health emergency, you'll grant this emergency use authorization, and then as more of the data is collected and assuming things continue to look good, the company is expecting later this month to probably have enough to submit. So that's really exciting because it means that it would move it into, again, the confidence couldn't be higher in this vaccine, right? And broadly, COVID vaccines in general. We've given more than 2 million here in Chicago. We're almost at 250 million across the U.S., a billion or almost a billion around the world. Really good safety and efficacy data. So that's exciting. And then the last piece of news, if people saw, was that Pfizer also has submitted to FDA some studies about the way that the vaccine needs to be stored. So right now, Pfizer is the hardest vaccine for us to use operationally because it requires ultra cold storage, like way colder than a freezer. Outpatient facilities don't have this kind of ultra cold capacity generally. And then once you pull it out of ultra cold right now, you only have 5 days to use it. And that really limits our ability to put it in, especially outpatient settings. Whereas Moderna, you have 30 days to use it, and then Johnson & Johnson can just be stored at the refrigerated the whole time. So Pfizer has submitted some data suggesting that once you pull it out of ultra cold, you actually could have, I think it was a month or 28 days,
wow.
I don't know the details, but a much longer time period to be able, I think it was 4 weeks, to be able to administer it more in line with what you can do for Moderna. So we're really hoping that that data looks good and that FDA approves that, because it would really up our ability to have Pfizer available.
It's a game changer for the logistics, right?
It is, and especially where you think about kids, where do kids get their vaccines? Most of them get them through the pediatrician's office. So being able to get this vaccine out to pediatrician's offices, and they'd have 30 days to have it in their refrigerator to be able to use it, would be really exciting. So that was one of those, like, it doesn't make the top of the news when it comes to vaccine news, but for those of us who think a lot about operations, it was a really exciting piece. And they actually signaled that they're hoping by later this summer to have some data or some changes that would maybe allow it to be 10 weeks even out of the, once you've pulled it from ultra cold. So that, they're thinking a lot about how to improve the usability of this vaccine.
Yeah.
So.
Wow, that was a lot.
That was a lot, but see, these are
thoughts.
good updates.
Yeah, these are good updates.
Yes.
One, it's just a reminder that the research is ongoing.
Yes,
right? The
very
work
much.
is ongoing. Two, it just also reminded me that we can see in our own data the impact of vaccines.
Yes.
Especially in those kind of closed congregate settings. So we can see the efficacy of the vaccine. Just a quick question about the move to 12 to 15 and then 2 to alongside the full authorization. Are we going to move into a world where these vaccines are required by schools? Or is it going to be kind of like how some vaccines, when you go to the pediatrician, they're like, would you like your child to get this vaccine, or would you like, or not?
Yeah. So I don't know the full answer to that question just yet. We've already seen some universities saying, I'm going to require COVID vaccine for students coming back in the fall. I think that makes a whole lot of sense, particularly for, you think about in colleges, if there are kids living in these congregate living dorm type situations. Yes. We know, we've seen it happen, that COVID can spread really widely. And so we've already seen some of those universities doubling down on that. Certainly there is a long history of requiring vaccination in different settings. Healthcare settings would be one example. So the hospital where I used to work, you had to get a flu vaccine. If you did not get a flu vaccine, you had to fill out paperwork, et cetera, and you had to wear a mask at all times while you were working in the hospital during flu season. I think, there's still a lot of conversation about what some of this would look like. I think another possibility would be, a required vaccination, like in a healthcare setting. But if somebody isn't going to get vaccinated, they may need to get very frequent COVID testing, some of which we have already in place in healthcare settings. But I think there will be some different gradations of this, but I think especially in healthcare settings where people are interacting almost by definition with people who are at high risk for severe outcomes for COVID and or maybe sick with COVID themselves, we know that protecting health workers and the patients who go to them is a really high priority. So I think already we have seen some settings, including here in Chicago, some of the long-term cares, et cetera, say it's a requirement, like for staff, for example. And I'm sure we are going to see some more of that in healthcare settings. I think in the school settings, we're going to see what comes a little bit. There certainly has been some interest. I read some interesting legal analysis on this, where probably you don't need the full approval of this. Like, you could make it mandated even while it's under emergency use authorization, because we're under a public health emergency. Like, you absolutely, most of the legal scholars, at least that I've been reading, I'm not a lawyer, but I've been interested in this, say that it's not a requirement. But I think that there are a number of settings who have felt like they would rather have that full approval to be requiring it. So I do think when that comes through, when they submit to FDA, it's not going to happen overnight. This will probably take, I would guess, a number of months to get that full approval. And so I think we'll see. There are vaccines right now, if people don't know. For example, at Chicago Public Schools, there are vaccines that are required for school broadly. You're able to get an exemption, but that needs to be signed off really by a pediatrician or by a doctor saying that they've explained, the risks and the benefits. And it's always a hot conversation there. So knowing that, I think it's likely that adolescents it'll be approved for, but we'll probably still be working on getting kids vaccinated, et cetera. And younger kids still won't be there. I'm sure there won't be sort of system level plans for this, but it's going to be a big conversation. I think at schools really across the country. And having a fully approved vaccine, including for kids, I think is one of the first steps in that conversation. But my goal really always is not to mandate, but instead to encourage, educate, and help people understand, that if they get vaccinated or their child gets vaccinated, that's the most important thing to do in terms of, protecting your child, protecting your family. And I'm more interested, certainly at this point, in continuing that education as opposed to really moving toward mandates. But I think in the healthcare setting, we're going to see more and more of them.
Okay. All right. So sorry, I snuck my questions in. Let's get to your questions. There are a couple related to testing. You mentioned the milestone for testing. From Mary Rodriguez from Facebook, thank you, Dr. Arwady, CDPH, and Mary Lightfoot for the leadership, thoughtful decision-making, research, and planning throughout this past year.
Thank you.
Always
Nice.
Always nice. Always a surprise.
Yes.
Are over-the-counter rapid tests pretty reliable? I know early on rapid tests were not as effective as the deep nasal swabs.
Yeah, really good question. So the tests that are most available now, these new over-the-counter, they are actually the Abbott Binax Now tests that have been very widely used as rapid tests. Just previously, there needed to be someone who was fully trained doing it and sending it in. There was more oversight of it. So these are the most used, I would say, rapid tests, and they're good. No test is perfect, which is partly why they actually recommend doing those two tests 36 hours apart from each other. When you do two tests, the idea, and this is approved, to be clear, it's authorized for use in people who have symptoms or do not have symptoms. But if you do not have symptoms especially, they recommend doing those two tests, because two tests of somebody who don't have symptoms really increases sort of that sensitivity in case somebody did have COVID. So no test is 100%, but these are really as good as they get in terms of the rapid tests that are available. We're confident in them. They wouldn't be approved for this sort of over-the-counter use if they were not very broadly sort of accurate. They're all what you do get, just a little bit more sensitivity if you do that very deep nose swab. So, I would encourage, if you're really feeling like you might have COVID, take the test. But if you're very concerned about it, you might want to give a call to your doctor, just to have some more conversation. But broadly, they're very good tests. I want people to feel confident in them. I'm really excited that they're widely available, because anything that drops the barrier to testing means that, you can imagine people saying, I want to have a dinner party. Like, let's get everybody tested. We're all going to feel more confident, right? And I think as sort of the months move on here, having testing very widely available, I think is only going to increase people's confidence. So, really good question.
Yep. Mulligan Stew, do any of the COVID tests being used, PCR, antigen, or antibodies test, to confirm a positive COVID case also register positive for any enteroviruses or rhinoviruses?
Yeah, good question, and the answer is no. So the question is about, can you get a positive COVID test if you actually have a different virus? We call that cross-reactivity. So if somebody has, an enterovirus or a rhinovirus, those are the fancy names for like a common cold or, another sort of respiratory type infection that are pretty common. Will the COVID test turn positive, but actually you have a different one? And the answer is no. And that's because the kind of technology that we use for the COVID test is specific to coronavirus. And so another version of this question I sometimes get is, what if I have a variant, right? Will it still show up? And the answer is yes, because what the test, whether it's the rapid test that someone's doing at home, whether it's the test at the doctor's office, any of those tests, they're all using the technology that's looking specifically for coronavirus, specifically for COVID-19, and then it can't tell right off the bat if it's a variant. There needs to be a second test that would be done that would kind of look at the genetic fingerprint of the COVID virus. So we can talk some more about that if you have questions. But broadly speaking, no, we don't see cross-reactivity with these tests. It's kind of like before COVID, if you were sick and you were in the hospital, you would sometimes send what's called a respiratory panel, which is you take one swab from somebody's nose and you send it in, and there's, they might test for 12 different viruses and it'll come back which one was positive. You can now, you could include COVID within that panel of the respiratory viruses, but it's not like it would turn positive for one of the other viruses or vice versa.
Got it. At Miggy Peace from Twitter, if 4 people are fully vaccinated and 2 are not vaccinated at all, sounds like a math problem. If 4 people are fully vaccinated and 2 are not vaccinated at all, what is the safest way to be together for Mother's Day? The elder is vaccinated. Oh, and then this person says, sounds like a word problem. Yes, I agree, Miggy Peace.
Okay.
So Mother's Day,
Mother's Day.
4 people, including the oldest person vaccinated,
Yes.
2 people not.
All right.
What's
So
the
I am
safest way to
glad
go?
that 2/3 of your folks are vaccinated. Really the safest thing, if you still have a mix of folks who are vaccinated and unvaccinated, a couple things I would recommend. I'm hoping we're going to have good weather and you could be outside. That always makes it safer. And especially if you're going to be inside, wear the masks. You know, right now there's
Everybody,
I would
all
recommend
6.
everybody still. Yeah, the recommendation is what, you know, it's, and you know, I don't know the exact details of like this family or how old the older person is or whether there's people with underlying conditions, but it sounds like there's enough of a concern about that. You know, the CDC, for people who are fully vaccinated there, the risk is going to be really quite low, but it's going to be 0. The persons who are unvaccinated for sure need to wear a mask. And then if people are worried about it, if you're gathering, I still, like if I am gathering in a setting with people who are a mix of vaccinated and unvaccinated, I still wear a mask. I just do right now while we're inside. And, you know, I hope.
And it's become a thing where, at least I've seen it, where people ask,
Yeah.
are you vaccinated?
Yeah.
Are you fully vaccinated?
Yeah. Absolutely. And so, you know, I'm not, I don't have a high level of personal concern for myself in that setting, but I also know there is still a fair bit of COVID, or, you know, more than 500 cases a day every day in Chicago. And so I feel very confident, you know, when I'm in a group and everybody is fully vaccinated, I'm comfortable not having my mask on. You know, I can go to dinner with my friends and everybody's vaccinated. Like, it's been really lovely to, if you are confident that everyone you're gathering with is vaccinated, to be able to, you know, not have that worry, and especially in a setting be gathering. But if it's a mix, definitely the person who's unvaccinated, and I would, if there's someone who's elderly, I would still recommend right now keeping the mask on, especially if you're going to be inside.
All right. Belinda Jackson from Facebook, good morning. Do you think having mobile vaccination vans to go out in the neighborhoods with the J&J vaccine one-shot dose could get vaccination rates, I think, up in the city?
Yes, and in fact, we are doing that. So I realized actually I meant to show and I forgot. So let me actually show you. I completely spaced on this. I was actually going to show a couple of quick announcements, one of which was about the vaccination bus. So let me show that real quick. I think it was my first time doing this. Just kind of as a reminder for folks, ZocDoc.com/vaccine or 312-746-4835. That is the website you can go to. There are appointments available all over the city. You can call that number. There's not a wait. People will help you figure out how to get a vaccine. If you need a ride, what's near your house, get your questions answered. We want your calls, and we want to help you get connected to vaccine. This was a nice note. I'd encourage people to share this on Facebook. If you don't follow the Chicago Department of Public Health on Facebook and you watch this, you're clearly interested in public health, so I would encourage you to follow CDPH. We've been trying to post things that you could share if you were interested on social media. So I like this one, the only card your mom wants to see this Mother's Day, and it's the picture of the vaccination card. So that was that. And then this is just sharing, again, just some more details of some of this. Let's get back to things this summer. The May 8th, which is Saturday, you can get vaccinated at Apostolic Faith Church, get a free ticket to our Protect Chicago Music Series kickoff event. We've got a Family Day event, Mariano's Bronzeville, on Friday, 12 to 6. It's tied to Mother's Day. They're giving away free flowers to moms, the first 200. So bring your mom in, you know, let's get vaccinated, get flowers. We've got another one, Logan Square, Avondale vaccination event. That's on Saturday, 9 to 1. Again, sort of a focus on moms and thinking about bringing folks in. And you can go and read some more about the details of these, but there's various, you know, little perks for folks who get vaccinated. And then we are this Saturday doing our first, in partnership with CPS, our first vaccination station, which is what we call our vaccination bus. That was what reminded me of it. Our vaccination bus has already been going out and going around, and I'm going to share the schedule for the next couple of days in a minute. But we also are working, and especially looking ahead to likely authorization for adolescents, we are 100% partnering with CPS and CTU around getting the news out and then pairing vaccination opportunities at high schools. And so Fenger High School on Saturday, 10 to 12. It's open to all students, families, community residents. We're going to have both Pfizer and J&J available. J&J is only for those 18 and older. Pfizer is the only one approved right now for kids who are 16 and 17. But we'll expand this, you know, probably assuming that the other that the vaccination gets approved. And a parent or legal guardian does have to be on site right now for 16 or 17-year-olds. But then yes, here's our vaccination station, our Vax Bus. And if you haven't seen it yet, there's some more that are getting wrapped. And thanks to CTA, who has just been lovely in terms of thinking about this. You know, this is a bus that has been reconfigured. Some of the seats have been pulled out. There's tables. We don't vaccinate you while the bus is moving, to be clear about this. But
the bus pulls up.
The bus pulls up and it stops, and we're sort of experimenting with different routes and where to go. So over these next couple of days, for example, tomorrow we're going to be in Austin at the North Austin Library from 10 to 2. On Saturday, we're going to be at the CPD District 15, 10 to 2. And then also on Saturday, we're going to be down in Roseland. Like I said, so we have been really experimenting with this. You don't need an appointment. The idea is you see the bus. We want to kind of bring a party with the bus.
Get on the J&J bus.
Get on the J&J bus. But we're also offering Pfizer, actually, because we're working to really make sure people have choices here.
Yes.
And we know a lot of people like the J&J because it's one and done, and especially if I didn't plan it first, they like the idea of being done. And we're seeing more people on the bus actually choosing J&J. But if there are people who want Pfizer, like, we want to accommodate that. I know there are people, with that pause from a couple of weeks ago, even though we didn't end up finding a major safety concern. Certainly, I know there are people who say, I don't want the J&J, I'd rather get this other one. No problem. We'll give you that first dose of the Pfizer on the bus and then give you the information for where and when to get the second dose. So yes, we love the idea. We love our Vax Bus, and we think it's a good one. And we will be doing a lot more of this, bringing vaccine to community events. Later in the summer, block parties. I mean, all of this sort of thing. Where are people, and how can we work just to make vaccine access really easy for folks?
Yeah.
Thanks.
And really, with that July 4th target date, these next 2 months are the best months. If you've been waiting,
that's right.
The best months.
That's right. And,
to get it done.
I didn't say this, but President Biden had said, really as a goal, 70% of adults in the U.S. to get at least a first dose by July 4th. That's a pretty audacious goal.
It is.
We're at about 56, 57%. I think 56 today. 56% of Chicago's adults have gotten that first dose. So.
Come on.
56 to 70, right? Can we do it? We'll see. I think we can. We've got thousands of people getting vaccinated every day here in Chicago. But it does mean sort of saying, if it was, we've got a lot of people, I think I said this on Tuesday, who, it's not that they said, I don't want to get a vaccine. It's just kind of like on the list next to.
I'll do it whenever.
Yeah. Get an oil change,
right.
Or like return that old library book or whatever it might be. Let's kind of get that vaccine done.
We want to bend the curve up.
We do. The vaccination curve. We want to bend up.
That curve.
Yeah, that curve.
That curve. Okay, so I think you kind of answered Luke Grimes' question. His question is, where is the J&J available? I've been trying to find it for days.
Oh, okay.
So I think there are lots of places you can go and get the J&J.
There are a lot of places. And as always, the reason I showed that slide, so online, your easiest, ZocDoc.com/vaccine, you will see where the city is, for example, offering J&J, we say it, like which vaccine is available at which site. So right now, for example, you can walk in or make an appointment today at the United Center and get J&J as walk-in. We're doing we're doing like a 1 week of J&J walk-in to get a sense of what the interest is there. And then actually on Saturday, we are bringing back, we were doing second doses, we're bringing back the next round of drive-in at the United Center, and we're going to offer both J&J and Pfizer through the drive-in. Again, to this point that a lot of people want the one and done. If you want the Pfizer, no problem. We'll give you that first dose. Make sure you've got the information of how to get a second. But yeah, there's lots of opportunities.
Today's your lucky day, Luke.
Today's your lucky day. See, Chicago State University has J&J available through the drive-through, I know. If you're interested in getting vaccinated sort of over the weekend, like I said, the Vax Bus at all of those sites has it available. There's multiple sites. Kennedy King this weekend has J&J available. all sorts of opportunities. And then a lot of the pharmacies have it too. So if you want to go to a pharmacy, give them a call or walk in, right? Many, Walgreens, for example, has said we're moving to walk-ins there too.
Walmart is already there.
Walmart is already there. And then your providers. We have given vaccine, including J&J, to any provider in the city of Chicago that has requested it. And so we have pushed all kinds of vaccines, whatever type of vaccines providers want and have the capacity to store, they're able to get at this point. So as always, where most Chicagoans have gotten vaccinated is still through their healthcare provider, and that can be another good place to go too. But show up at the United Center today and get it done.
All right, so you've answered a couple of other questions that were here. One was about where you can go to get a shot on the weekend.
Can I just, because I want to just take that real quick, maybe, like just to give a sense. So go to ZocDoc, but also, if you just go to chi.gov/COVIDvax, we have a big list, and there's a map that really highlights all the places that sort of have publicly available vaccine. And I'm just going to read through just the city events, if that's okay, because I can't even keep them all straight in my head right now at this point. But they're all available for you to find. If you call that number, 312-746-4835, someone will also answer that question for you. I want this vaccine on a Saturday at this time. So on Saturday alone, just the city-sponsored and partnered events, not including everything the private providers are doing, not including pharmacies, not including employers, not including homebound, not including, strike teams, just the publicly available sites. Saturday alone, we've got Wrigley Field open 8 to 4. We've got Apostolic Faith Church open 9 to 2. We've got Chicago State University with both Pfizer and J&J available 9 to 3. We've got Kennedy King 9 to 3. We've got Daly College 9 to 3. We've got the United Centers open 9 to 7. There's both walk-up and drive-through. Pfizer and J&J in the drive-through. We've got Wilbur Wright's open 9 to 3. We've got Loretto 9 to 3, and then we got the Vax Bus at 3, 2 different sites that day alone. We've got in Logan Square, that's the Avondale vaccination event. So just giving you a sense, there's multiple available again on Sunday. Lots of opportunity. We've worked to make sure there's some evening availability. So if you're not sure, call that number, go to ZocDoc, or go online. We're working hard to make vaccine available for people, even if you're working during the week.
All right. And then I think you answered Faith State's questions, kind of. The drive-through at United Center is opening up again.
Saturday.
And then are there other drive-throughs? It sounds like there might be one at
Chicago State has a drive-through available as well. Those are our 2 drive-through locations right now.
All right. Some questions about kids. Katrin Kumar from Facebook. What will the vaccine rollout look like for 12 to 15-year-olds? How quickly do you think they will actually be getting the shot in Chicago after FDA approval?
Pretty much right away, I think. We have been planning for this for a long time and working with a lot of our partners, where you think about Lurie and some of the children's hospitals, they've been really central to thinking about what does it look like to Pfizer's, again, the only vaccine approved for kids. Hospitals tend to be the ones that have that ultra cold storage. So how do they work with their network of pediatric providers? We've been in conversations, CDPH regularly works with pediatricians around vaccination. That's the bread and butter of what we do every single year. But this vaccine, obviously, coming in at different stages for different folks, and some of the storage requirements have made it a little more complicated. But we intend to open all City of Chicago points of dispensing. So all these things that I've read that have Pfizer would be open, probably I would guess on the day that, the FDA needs to approve it, and then the ACIP, the Advisory Committee on Immunization Practices at the CDC, also has to sign off. They're the ones who actually recommend things like timing of vaccine for kids, like how many weeks do you need to space it compared to other vaccines, any other recommendations. So that needs to get approved. Once all that is done, I would expect as soon as the next day, we will probably be ready to go. We've also been working to make sure that all the pharmacy chains, at least in Chicago, are ready to go with vaccinating all the way down to the age of 12. The regulatory stuff is in place to do that. We've already been in conversations about it, really wanting to make sure we can hit the ground running and get folks vaccinated. And just as a reminder, You do need a parent right now if you're under 18 coming in to get that vaccine. But we want you coming in with a parent and a grandparent and a great aunt and whoever else.
We make it a family
Make it a family event. Come in, everybody can get vaccinated. And for children, again, Pfizer is the vaccine that has been approved at this point for 16 and 17-year-olds. And it's the one that we're anticipating likely approval for 12 to 15-year-olds, potentially as soon as early next week.
Right. And that's a good point. It's not like you have to order a special batch of Pfizer for this age group. We've got the Pfizer.
That's right. We've got the Pfizer. It's the same dose in the studies. They look at dosing, they look at immune responses. And the good news was, like in the 12 to 15-year-olds, it was no issues with serious side effects or serious problems, and really good in terms of how the vaccine was producing immunity. The levels of antibodies, for example, in the blood for the 12 to 15-year-olds was even higher than it was among the young adults. So every sign that, highly protective, obviously, first and foremost, safe vaccine for this age group. So for people who are wanting to do sports and wanting to do camp and wanting to get together with friends and everything this summer, just exciting to hopefully have a vaccine. You would need both doses again for kids as well, we would anticipate. But, we could talk about by June, starting to have kids, some adolescents, fully vaccinated. Like just, again, that opportunity so much drops the risk of when kids are getting together.
Yeah. Okay, I think time for one last question from Cindy W. My 13-year-old daughter just got HPV and the hepatitis shot, but I want her to get the COVID vaccine. How long should I wait, or do we know yet?
Really good question. So again, the ACIP with the CDC will weigh in on the details of that. What they have recommended for adults, and actually for 16 and up for Pfizer, is that you wait 2 weeks, either before or after the COVID vaccine. And so I don't know for sure if that will be the same recommendation that ACIP will make for the 12 to 15-year-olds, assuming that this moves ahead. My guess is that they will, but there are, to your point, and thank you for making sure your daughter's getting up to date with HPV and hepatitis, super important. There are more vaccines that children and adolescents get, and so the question of timing is in some ways even more important. And so, I'm actually interested to see whether ACIP will stick to that 2-week window or not, because as a pediatrician, it is extremely convenient to be able to give all the vaccines together that a child is due for. So it's actually, that's a little bit of insider baseball, but it's one of the things I'm the most interested to see what the ACIP recommends. So I don't know yet, but my recommendation, based on older children right now, would be if she got this, you would wait 2 weeks and get the COVID vaccine. I have no reason to think it would be longer than that, and there's some possibility that ACIP, just recognizing the need to make sure that kids are getting their regular vaccines too, it's possible they may say that there isn't a need to space it out. Hope that helps.
All right. Well, any quick good news stuff?
Any quick good news? I read a nice study in The Lancet. The author was Frater, F-R-A-T-E-R, looking at folks who had HIV and who had been vaccinated. And they found, after getting 2 doses of vaccine, both the antibodies and the T cell. There's a couple different ways that your body gets immunity after a vaccine. Some are antibodies, which we talk about, but there's also this more cellular immunity, which might be longer lasting. The good news was that they compared 54 HIV positive men and then 50 HIV negative participants, and the levels were comparable. There was no difference. And there were no serious adverse events. And so it was one of the first studies that I'd seen that really was very specifically answering. We knew that this would broadly be protective, but there's been some question with different types of potential immunocompromise, whether the vaccine would sort of mount that full response. And at least in this study, it was a very nice assessment that both kinds of the immunity actually were similar. So that's good news in terms of thinking about folks who have HIV and that recommendation for vaccination. Always I encourage people to talk to your doctor, but that was good news. And then I think one other thing is it is National Nurses Week, and knowing that nurses here in Chicago, across the country, around the world have just been
big heroes.
Big heroes, working their hearts out. I mean, they do all the time, but for this last year and a half especially, nurses provide so much of that hands-on care to a lot of the sickest patients for COVID. They are, known to be really some of the most trusted professionals in the country, and really want to give a shout out to nurses. There are more than 4 million nurses in the U.S.
Wow.
And National Nurses Week starts today, and it runs through May 12th. It actually ends on Florence Nightingale's birthday, I learned. So thank you. If you know a nurse, send them a shout out. Really thank them for the work that they've done in COVID, but always. And I wanted to give a shout out to them. And then one other thing is that there's a temporary food benefit program that's operating during COVID. So if there are children who normally might be getting access to food through schools, et cetera, there's been an ability to get additional funding for families to be able to support food needs for their kids. And so it's called the Pandemic Electronic Benefit Transfer.
Yes.
And it actually provides benefits retroactively to the start of the school year. So it can be an important resource for families. The Greater Chicago Food Depository has put together information about this in English and in Spanish. You can find a link to it on our COVID page. You can find a link to it at the Greater Chicago Food Depository. But, especially if you know a family with kids, that maybe, a lot of families have been struggling this year economically, this is just an important benefit for people to know and be able to access and make sure that we can have good food security for all families here in the city. So that was my other piece of good news.
All right. Well, I guess we're done for today. Back on Tuesday?
Yep. Plan at the moment is to be back next Tuesday at 11 Central. Keep sending in your questions. If we don't get to them, we try to post them online. Explore, the data. We've got all kinds of things up about vaccine if you want to see how we're doing. Chicago, when we looked at it last week, still is #1 among the largest cities in the U.S., #1 for vaccine coverage, #1 for Latinx coverage, #1 for Black coverage, but still a long way to go. And if we're gonna work on equity, if we're gonna work on making sure our communities are protected across Chicago, and we just want to put this all behind us. It's about getting folks vaccinated. So have a conversation. What's that? Rear view mirror. We sure do.
Yeah.
So thank you for tuning in. Thanks for your questions. We'll see you next Tuesday.
Yeah, keep protecting.